The executive director of the Community Oncology Alliance joins us now, Ted Okon. Ted, how are you, man? Good to talk to you again.
Hey, Mark, I'm great. Good to talk to you again, and thanks for having me back on MIP.
No, it's our pleasure, and we want to. We've got a lot to talk about. You know, first of all, I guess what's foremost in a lot of people's minds is we want to get to the health care bill, of course. What are you going to be on Capitol Hill doing tomorrow, Ted?
We're going to be actually very interesting. We're going to be giving a briefing to health staff on the House side about a major study that we did looking at the components of cancer care, what it actually takes to deliver cancer care. And then the second half of that is we are going to talk about some of the Medicare cuts to cancer care that were just enacted. So we have two oncologists, Dr. Dave Eagle from North Carolina and Dr. Patrick Cobb from Billings, Montana, will actually be respectively reviewing the results of the study and the Medicare cuts with the health staff on Capitol Hill in the Rayburn building. The good news is we're doing an even better job of treating cancer care, which is treating cancer in this country, which is why we have the best cancer care in the world, as documented by actual survival rates. But the problem is, and this is part of healthcare reform, Mark, as you know, is that, the costs are increasing. Newer technology, new costs. So we do our best to try to keep those costs down. But some of these cuts are really artificial and they're very harmful. In fact, Dr. Cobb, who will be presenting the data on the cuts, he just had to close a facility in Wyoming, which is in a rural part of the state where now it's going to require cancer patients to extensively travel to find care, literally because they just couldn't keep incurring losses and keeping that facility open.
Before we go to the phones, has the Community Oncology Alliance, Ted Okon, of course, Executive Director, Ted, has it taken a position on the pending health care legislation?
We have not taken a formal position as much as what we've laid out is that what are our tenets for healthcare reform. And I think that the problem is that, Mark, we are seeing some of the things in healthcare reform in the House bill that was passed and in the Senate bill that we're waiting to take a look at. There are some very good things like expanding coverage. Certainly no one in this country should be without quality cancer care. And so there are some very good things in terms of subsidies and help for people, but there are some things that are missing from the bill, including literally provisions to stop some of the cuts that we see on a regular basis to cancer care.
Yeah, good points. 866-997-4748, communityoncology.org. Several calls. Let's get right to them. Laura is in Iowa, our Facebook administrator. Laura, God bless you.
Speaking from Iowa, which is the lowest paid Medicare, state in the country, I can say that, when you were talking about Medicare, and there's a lot of abuse. There's a lot of patients that we do x-rays on inpatients over and over and over every day. And, if we could cut out that waste in Medicare, we would save a lot of money and build it back up. Because we see it every day as x-ray tech. These doctors ordering CT scans 2 days apart on a kidney stone. They certainly could wait a few more days or wait till the patient gets better. There are so many things we could do better with Medicare patients right now that we don't need to do. We see it as x-ray techs. We're not doctors. We certainly cannot tell Dr. Jones that he cannot order another CT on this patient. It doesn't require any pre-certification, and we just do them day after day after day after day after day. And you know what? We're all paying for it. So when they talk about cutting Medicare, that's one place we could start.
Well, I can just add, Mark, and tell Laura that actually in the House bill and more than likely in the Senate bill, there is a provision to cut imaging services, and the government does believe that there is a lot of churning of those services, and I think that some of the cuts that they have will have the intended effect of pushing those back.
Ted Okon, communityoncology.org, on Twitter, twitter.com/oncologyCOA. Ted, always good to talk to you, man.